Hello all. Today I am going to show you about community bag technique. The community bag or public health bag is designed to carry equipment and material needed during a visit to the home, school or a factory. The community health bag is an essential and indispensable equipment of a public health nurse which she has to carry along during her home visits. It contains basic medications and articles which are necessary for giving nursing care. The community bag helps to render effective nursing care to clients and or members of the family during every home visit. The important principles in the use of bag which helps to prevent spread of infection includes cleanliness of the bag. The community bag must be kept scrupulously clean and ready for use at all times. The second principle is hand hygiene. Wash hands before opening the bag. The third principle is sterilization. Clean and boil the instruments after the use and replace it safely. And protection of the bag as well as articles after care. After the care, articles must be washed and boiled properly. The next principle is improvisation. As the bag has limited articles, we must use the available resources and perform nursing procedures. Then refilling or restocking. Check the bag daily and make necessary replacements. Standing orders. While administering medications, standing instructions or individual instructions must be followed. The next principle is economy of material and time. Supplies and equipment must be used economically. It also saves time and effort in the performance of nursing procedures. Let us see the design and arrangement of community bag. Each institution uses different models as well as designs of community bag according to the availability. This bag contains one upper compartment, one lower compartment, two side pouches as well as one back pocket. So this is the upper compartment, also called as sterile compartment. The sterile compartment has partition. So one side we can keep all the medications as well as solution. The other side we keep all the sterile articles. So the sterile articles are placed in two cloth bags. One cloth bag contains sterile instruments. So this bag is labeled as sterile instrument bag. So whatever the instruments we use in the bag will be kept in this sterile instrument bag. Example: scissors, forceps, tongue depressor, ball, etc. will be kept in sterile instrument bag. The other sterile bag labeled as sterile cotton, gauze and dressing pack. So this bag contains cotton ball pack, gauze piece pack as well as dressing packs. All these small packs helps to minimize contamination. As per the procedure requirement, we can carry the required cotton ball or gauze piece or dressing packs. And each pack must be labeled accordingly. The other partition, as you see, contains all the required solutions as well as medications according to the standing instructions. Example of solutions: betadine, spirit, Savlon or Dettol, hydrogen peroxide, acetic acid, Benedict solution, etc. The sterile compartment must not be exposed for a longer period to the external environment. so as to prevent contamination. Also, we must wash our hands thoroughly before opening this sterile compartment. The second compartment is the bottom compartment or the clean compartment. So the clean compartment also contains a cloth bag. So this cloth bag is used after completion of the procedure. After washing the instruments, we can keep in this clean bag, and after the sterilization of the articles only, the used articles must be replaced into the sterile chamber. The clean compartment contains all the clean procedures, example urine testing articles like a test tube holder, kidney tray, spirit lamp, matchbox and catheter, fetoscope and other instruments. After every procedure, these articles also must be washed properly before replacing it into the clean compartment. So these are the two main compartments of the bag, the upper sterile compartment and the lower clean compartment. Apart from that, we have two side pouches. One side we can keep hand washing articles. The other side we can keep paper bags and extra newspapers. And there is a back pouch. This back pouch is used to keep all the disposable articles. Example, apron, micropore plaster, measuring tape, sterile gloves, syringes, HB monitor, and also we can keep stethoscope, personal diary, pens, pencils, eraser and torch light, etc. So this is about the placement of articles in the community bag. The bag should contain all the necessary articles, supplies and equipment that will be used according to the need. The bag and its contents should be cleaned very often. The supplies must be replaced and it should be ready for the next use. Now let us see the steps in performing community bag technique. The community bag must be carried onto your right shoulder, with the opening of the bag should be away from the body. Upon arrival at the patient's home, first greet the patient and choose a clean, flat and higher surface to place the bag. Make sure that the surface must be clean. If higher surface or table is not available, we can ask the householders to spread a mat, or we can also spread a newspaper or plastic sheet to place the bag. It helps to protect the bag from getting contaminated. Place the bag towards the corner of the bag, and the thread of the bag must be placed under the bag, so the thread will not disturb with the procedure. The opening of the bag must face towards the working surface. The other side of the newspaper can be utilized to place all the articles. Then we can loosen the bag or unbutton the bag, and make sure to not to open sterile compartment. Now we can take a newspaper as well as hand washing articles and find out the hand washing area. If hand washing facility is not available, we can ask the householder to give a jug of water or basin of water to wash hands. So spread a newspaper near the hand washing area and arrange all the hand washing articles. And then remove the wristwatch and then place it according to the convenience. Now, according to the hand washing procedure, we can wash our hands thoroughly. Now, after hand washing, we should not touch the outside of the bag because it is considered as contaminated. With the help of 2 fingers, we can touch the inside of the bag and open the bag. And from the sterile compartment, if any articles are required, we can collect the articles according to the type of procedures. For example, now we are going to show the TPR procedure. So for TPR procedure, we require cotton balls, thermometer, as well as disinfectant solution. A paper bag is already placed outside, and immediately we must close the sterile compartment to prevent unwanted exposure to the external environment. Now we can follow the steps of TPR procedure and can check temperature, pulse as well as respiration. The only difference with the clinical procedure as well as community procedure is, in clinical procedure we use a tray to arrange all the articles, whereas in community, as we cannot carry all the articles, we spread a newspaper, a clean newspaper. Over the newspaper we arrange our articles. After the procedure, we must place the soiled cotton swabs in the paper bag, and then we must disinfect the thermometer by using a disinfectant cotton swab as well as soapy cotton swab, and also we must wash the thermometer under running water and then replace it into the unsterile bag. So after reaching to the hostel or home, we must disinfect the thermometer, then only we have to replace it into the sterile compartment. Now replace all the articles. The paper bag with soiled cotton swabs must be discarded safely by burning. After replacing all the articles, we must close the bag properly, and then we must wash our hands thoroughly and then collect all the hand washing articles which we have kept on the newspaper near the hand washing area, and then replace it into the hand washing bag. And replace it into the side pouch. After the procedure, we must write a brief note of the observation or the procedure done or instructions which we have given to the family members. And also we must write down all the necessary data that we have gathered, observed, or the nursing care or the treatment which we have rendered. Also we can give instructions for care of patient in the absence of the nurse. Now we can remove the bag and consider that the lower surface of the paper is contaminated. So we must fold it in such a way that the bottom of the paper should go inside. And we can make appointment for the next visit, and then we can leave the house. Thanks for watching. Please subscribe my channel for more videos and also give your valuable suggestions in comment section.